Dr. Hadi, and again, continuation of the behavior modification or cognitive behavior therapy. The recognition of our behavior is extremely important in a therapeutic sense. In cases related to severe traumatic effects, and based on a theory that we are unconsciously trying to repeat the scenario of the movie, so to speak, symbolically, that we were grown up. Like we as human beings are being born into a family, father, mother, siblings, and this is a movie that we are acting and we are playing in it. Now, what happens to this movie, how the characters work, somehow would be basing its future way of how we deal with our object and with other people around us. So, as an example, this family of a daughter born into a family of parents having severe problems, very conflicted situation. Now, the daughter is trying to be her best to keep this family going on, to keep the father and mother together. Having problems with the brother, with the other siblings, whatever happens, this daughter tries to be her best. But unfortunately, the father leaves the family. Now, what happens is that this movie stops at this point. If we look back at it, we see at the age of this daughter growing up, what traumas that was going on, what has happened to her, makes her someone who needs to be in her best behavior, try to have a sick role to keep the parents together, whatever she can do, by nagging, by destroying herself, by cutting herself, by becoming sick and being sick. So then, still after all that, the father leaves. Now, besides the genetic point and preconditions and chemical preconditions, in this case, this scenario begins to continue. This woman begins to be perfectionistic, obsessive, trying her best, trying to cling, trying to keep everybody together, trying to keep her friends together, trying to keep her husband together, being very afraid of people leaving and losing her. Unconsciously, by having that behavior, she's going to put people in a position to leave her, and this unconscious scenario begins to repeat itself over and over again. According to Freud and the fact that we are all unconsciously trying to reenact the scenario of our Oedipal and pre-Oedipal phase in order to be the master of that conflict. But in behavior, in a behavior therapeutic sense, recognizing this behavior and knowing how we should talk to others and how we should talk to them about how we feel, and believing in ourselves, even if we are altruistic and dumb, so to speak, and caring for everybody. If we believe in ourselves, then we would respect ourselves. When we respect ourselves, then others are going to respect us. And how it's going to happen? By changing our attitude and behavior and communication, not to put ourselves down, not to be negative about ourselves. That's very important. Now, therapy would help that a lot, because in that medium we can express all the negativistic ideation and then be treated for that. But with our friends and family and relatives and wife and children, usually it's not going to be the case. Thank you, and I'll talk to you later.